This is the right-sided tibia. It consists of an upper end, intervening shaft, and a lower end. Upper end is more broader than the lower end. The anterior border is sharp and it is directed anteriorly. This is the tibial tuberosity is directed anteriorly, and the lower end consists of a malleolus which is directed medially. Upper end consists of two condyles which is separated by an intercondylar area, the medial condyle and the lateral condyle. Now the medial condyle has the insertion has the muscle attachment of now this is the medial condyle. In the posterior surface there is the attachment of semi-membranosus, and in the tibial tuberosity there is attachment of ligamentum patelli. Now this is the lateral condyle. It has popliteus muscle and iliotibial tract. Now this is the intercondylar area from medial to lateral. There is the anterior horn of medial meniscus. Then there is the anterior cruciate ligament. Then anterior horn of lateral meniscus. Then back in the posterior surface there is the posterior horn of lateral meniscus. Then there is a posterior horn of the posterior horn of medial meniscus, and then there is a posterior cruciate ligament. In the posterior surface of the lateral condyle there is a facet which forms the tibiofibular joint, which is now the shaft. It consists of the anterior border, medial border, and the lateral border, anterior medial surface, lateral surface, and the posterior surface. Now the medial surface gives the attachment of the gyropes muscles. Gyropes muscle is coming from three different compartments, three different muscle origin, and three different nerves are innervating them. So the three muscles are: from the anterior compartment there is the sartorius, from the medial compartment there is the gracilis, and from the posterior compartment there is the semi-membranosus, and from the lateral posterior compartment semi-tendinosus muscle. Now this is the lateral surface. Lateral surface has the in the upper part there is the tibialis anterior, and the lower part from medial to lateral there are three muscles. Number one is the extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Now the posterior surface is divided by a soleal line into upper smaller triangular area, lower larger triangular area. Soleal line consists of the soleus muscle. Upper triangular area gives the attachment of popliteus muscle, and the lower triangular area gives the attachment of from medial to lateral. Medially there is the tibialis posterior, and then extensor digitorum flexor digitorum longus muscle.